Everybody, how you doing? We are here at TriStar Stonecrest Medical Center to bring attention to an event that they are doing on October 28th. It's Crush the Crisis Day, which actually goes along with National Prescription Drug Take-Back Day, which is happening at all TriStar hospital locations and actually all across the country. But here locally, they're actually partnering with the Rutherford County Sheriff's Department, so shout out to those guys. Thank you for helping with this. On their Crush the Crisis event, again, October 28th from 10 a.m. to 1 p.m. And with us today to talk about it, thank you, Dr. Shibiyama, for coming on and talking about this. And you have a long title I couldn't memorize. I'm sorry. So your full title.
My full title for this is the Medical Director of the HCA TriStar Recovery Program.
Okay, gotcha. Well, thank you for taking the time to come here. And we know you have surgery here in a little bit, so thank you again. And actually, speaking of surgeries, on a personal note, he worked on my dad's back 3 different times, and now my dad's up walking around. So thank you for taking care of my dad. Appreciate that. So about the Crush the Crisis event, this is a big thing coming along that you're helping to head up. If you don't mind, explain a little bit to our viewers about it.
So what the Crush the Crisis event, National Prescription Take-Back Day, is an opportunity for people who have unused narcotic prescriptions or other prescriptions at their home to bring back, to get them off the street or out of people's homes, really. And we also take back, all kinds of drugs. And the reason for this, the rationale behind it, is we know that the most common place where a child or a young adult is going to get their first narcotic pill is from their parents or from their grandparents' cabinet or from their aunt's cabinet, and that can start the cycle of addiction, and it's very insidious like that. So by getting that off the street, we can really stop an opioid addiction before it even starts. And those medications don't need to be out there. And if you have some leftover hydrocodone or oxycodone, and you've used what you've needed of it, it really just needs to be off the street, because it is just an opportunity for someone to develop an opioid addiction, which is a serious problem in Tennessee and throughout the country.
Oh yeah, absolutely, right here in our own backyard. And now, one thing we actually spoke before off camera a little bit was how COVID kind of exacerbated all this and made the numbers rise pretty quickly. So can you talk about that a little bit for me?
Oh yeah, no, COVID had a major impact on the number of overdoses and deaths, both from narcotics and also alcohol. And there's a couple of reasons for that. One, we were all isolated, and a lot of people weren't working, and we were sitting at home. And so a lot of people were sitting at home, they didn't have anything to do, so they were trying to figure out ways to fill their time, or they didn't feel good, so they said, well, maybe I'll take some medication, and then that led to some bad habits and things. And so that's one facet of it. The other facet is, during COVID, we couldn't sit this close together. We couldn't sit in the same room. And in recovery, connecting with other people in recovery and sharing your stories is so important for recovery. And we lost that completely for a long period of time. And in recovery, we say that connection is the opposite of addiction. And we had completely lost that. So people were isolated, they were depressed, they were anxious, they were bored. And so that was like the perfect storm for people to start medicating themselves with various things, and has really led to a rapid increase in the number of overdoses and deaths.
Yeah, I was looking at one of the stats here from 2021. So right after when COVID hit real hard in 2020, there was just over 30,000 overdose cases here, just in Tennessee, that were fatal and non-fatal. So 30,000 cases of people having to come into the hospital from overdosing on these drugs, and that's a lot, folks. So you guys doing your best to take those off out of the houses and get that down. But one thing I did want to talk about was fentanyl. Everybody's talking about fentanyl now. We see it in the news and all that stuff. So for fentanyl, I'm seeing there's a stat here that fentanyl use is quite on the rise. And so for those that have heard the term fentanyl and know it's a prescription drug, what exactly does it do to the body? How does it work?
So fentanyl is a narcotic, just like hydrocodone, oxycodone, morphine. The problem with fentanyl, a couple things. One, the problem with fentanyl is it is ultra potent. So a much smaller milligram amount will give you the same effect as a much larger volume amount of a different narcotic.
I gotcha.
And so I'm not exactly sure what this, but I think it's 1,000 times more potent than morphine. So that's same amount of morphine, the same amount of fentanyl that you would take is whatever that is, multiply that by 1,000, and that's morphine. And so you can see how deadly that is. And the drug dealers are becoming wise to, we're getting the prescription drugs off the street, out of people's homes, which is great. So, but then there's less pills out in the community. So the drug dealers are now they're getting fentanyl from China or from Mexico, and they're putting it in the pills, but obviously they don't have the same standards that a pharmaceutical company would. And so it really is like playing Russian roulette these days. Like when kids go to a party and someone gives them a pill, it could be laced with fentanyl. It could be completely fentanyl, and nobody really knows how much is in there. So it's really important for young people to understand, these pills really can kill you immediately. And you don't know what you're getting. And your friend says it is whatever it is. He may not even know that either. So fentanyl has really changed the game a lot, and it's very deadly. And so that's another thing people can bring in as well. Whatever prescription narcotic pills or drugs people want to bring in, we encourage everyone to bring it in and get it off the street.
So with fentanyl, in essence, people could unbeknowingly get a mega dose per se, and it'll kill them.
Oh, absolutely.
Jeez. All right. Oh, sorry, that's scary to think about. So, but as to your point, what you said with the Crest Crisis, no questions asked.
Correct.
People bring in their stuff.
Yes.
And then the sheriff's department is here and partnered with you guys for the past 5 years, I believe, which is awesome. Again, shout out to them. But they have to document all the drugs and everything that's given, right?
Yes, they'll take in whatever, but again, they will not ask you any questions, and they're happy to do it. And we just want to do our part, and they're doing their part to. Again, we'd like to stop an opioid addiction before it starts.
Absolutely. All right, cool. Well, we know you have a surgery coming up, so we don't want to hold you too late. But thank you for your time, really, and talk about all this with us. And then, again, one more time, the Crest Crisis, it goes along with National Prescription Drug Take-Back Day with TriStar hospitals all over the place and all over the country. But it's October 28th, Saturday, from 10 a.m. to 1 p.m. There's going to be a tent set up out front. Again, you can just drive up, drop everything off, and be on your way. So if you have any questions on any of that, put them in the comments below. We'll get to those as soon as we can. I'll also put some more information in the description if you want more information on that. And that's it. That's all we got for today. So thank you all for watching. We appreciate it, and we'll see you on the next one.